Good afternoon, everyone, and welcome to today's edition of Black Health Trust. We are so happy that you chose to spend this time with us. And without further ado, I'll turn it over to our founder, Dr. Randall Maxey.
Thank you very much, Dr. Barbara David Stevens, Dr. Walks, Dr. Lawson, Dr. Hines. Thanks for joining us today. And today's topic was actually suggested by Dr. Barbara David Stevens. She's always on it. So we're going to talk about things that are about your life and your health. And we're going to talk about what is the most common cause of atherosclerotic cardiovascular disease and heart attacks. So with that, let's go to the first slide. And Dr. Walker said, let me sit on the front row in church today.
Good. I was ushering today, so it's okay. Glad you were there.
Okay. You were ushering and I was on the front row. Next
Uh,
slide. Just put on the slides, please. And I may call on you for some help, you and Dr. Neighbor Stevens. So we're going to talk about understanding lipids and why they are so important and how they impact cardiovascular risk. That's so important. We know that a lot of things kill you and make you sick, but very few catch up with the amount of things that affect your heart. Next slide. So, what are lipids? Lipids are fats that circulate in your bloodstream. They're essential for energy and cell structure. They make up part of the cell wall. If you have too much lipids in your blood, it leads to cardiovascular risk and heart attacks. That's the simple. We can stop the lecture right there. That's what it is, lecture. But we go forward. Next slide. Arteriosclerotic cardiovascular disease is a leading cause of death in the world and United States. LDL, which is dense protein, it's a cause of atherosclerosis. LDL, that's bad cholesterol. Next slide. So there's a major paradigm shift in what the recommendations are out of the American College of Cardiology. And we know that a lower LDL, you need to treat it earlier and longer. There was a time when we thought that you didn't have to worry about it until you were 40 or 50 years old. But now it's proven that it goes back into childhood, and we need to test everybody. It's the cumulative exposure that drives the risk. So if you're young and your cholesterol is high, just think you got another 30, 40 years to collect that plaque around your blood vessels, and that's not necessarily good. Next slide. So what this new guideline does is return to the LDL targets. You target for it to be less than 100, less than 70, and less than 55 milligrams per deciliter of lipid. You treat to target. That is what is new. Treat it to target. Next slide. So LDL is a bad cholesterol. It's called low density lipoprotein. Cardiac cholesterol to artery. It carries the cholesterol to the arteries, and that's where plaque makes. Excess plaque builds up. The primary treatment is targeted in these guidelines. Next slide. That's Barbara David Stevens. You want to look at this one?
So we're looking at the LDL level versus cardio risk, and it is a very dramatic set of graphs bar graphs that we're looking at. If you are at the 70 target that we just talked about in the previous slide, you have the lowest risk. If your LDL is up at 160, God bless you, child.
yeah.
Are you muted, Doctor?
No, I'm finished.
Okay. All right, next slide. God bless you too. Will Dr. Walton take this one?
Statins. These are the medications that can be prescribed to lower that LDL. So they are first line treatment. An example of the statins are atorvastatin, and high intensity is preferred.
Next slide. Is Dr. Lawson on with us?
Don't see him yet.
You want to take this one then, Dr. Walks?
Okay. The effect of treatment on LDL. So if you don't have any treatment, you don't have any effect. That part's easy. If you are taking a statin, you may have I'm thinking this is a 30% reduction, without that being clear to me,
Yes.
Dr. Maxey, but
Yes.
you have a significant reduction. Okay.
Yes.
And then you add azitimib to your statin, and you can have much higher reduction. And triple therapy, you will have the highest reduction. So essentially, as Dr. Maxey said earlier, you want to treat to a goal. You're looking to lower that LDL to that preferred number. And if you can do it with one thing, great. But if it takes three things, great. Just make sure you treat to that number.
In sports, wasn't there something called a triple threat? If you can pass and run and kick, your triple threat. It's better now to use we talked about a stack treatment. So that stack treatment may be better than just the statin. So that's very important, Dr. Walks. Next slide. Is Dr. Lawson with us?
I can't see him yet.
Okay. Dr. Neighbor-Stevens?
So the guideline focus on LDL, as we've been saying, we want to treat to target. And the primary target for therapy is a goal of less than 70, and that would be high risk, less than 55 for very high risk. The lower, the better.
Next slide, Simon. So here's another graph, Dr. Neighbor-Stevens. Is this one?
So triglyceride levels. If your level is around 100, that's considered normal. If it's about 190, you're borderline. If you're at 300, you hit it, you're high. And if you're at 600, you are very high.
And say, God bless you again.
Yeah.
Next slide. So go ahead and do this one, Dr. Neighbor-Stevens.
So how do you manage triglycerides? The first line is lifestyle change. Treat the greater 500 to prevent pancreatitis, and omega-3s and fibrates as needed.
Okay.
Can I just jump in on this one, Dr. Maxey?
Of course.
When someone says anything that will help to prevent pancreatitis, pay attention. Pancreatitis is not something anybody wants. It tends to be extremely painful. So if you have a number and the indication is that somebody should treat that number to get it lower to prevent pancreatitis, sit on the front row.
And we talked a few weeks ago, Dr. Walks, about pancreatitis being one of the causes of pancreatic cancer, too.
Yeah. Yes, we did.
Yes, we did. So next slide. Let me know when Dr. Lawson's on. So good with this one, Dr. Neighbor-Stevens.
Triglycerides, an energy storage form in fat. Stored energy from excess calories gets converted to fat. Triglycerides are increased in diabetes and in obesity. High levels of triglycerides increase your risk of heart disease.
Next slide. So HDL, that's the good cholesterol. And somebody told me they had an HDL of 90 and they stopped exercise and went down to 70, but we'll talk about that later. So high HDL is good. It removes the cholesterol from the bloodstream. It plays a protective role. It's improved by exercise and lifestyle. So when somebody comes in with an HDL of 40, you know they're not walking around or exercising very much. They didn't go to the gym. Next line. So in the guidelines, the new guidelines out, HDL is not directly treated. It is improved mainly through lifestyle, but it is a marker of metabolic health. Next line. So understanding fats for heart health, saturated fats and their percentage. Dr. Neighbor Stephen, take this graph, everyone.
Well, we're starting with, I'm sure, something that a lot of us like, and that is our butter. But unfortunately, it has a very high saturated fat content of about 65%. The spreads, like the margarines, they have a much lower saturated fat content. And olive oil has an even lower percent of saturated fat, down maybe about 12%.
Hmm.
So butter is at 65, olive oil is down at 12 or 15. I think you know where your choice needs to be.
Next line. Dr. Walks.
Okay, this is the the previous slide was the slap, and this slide is the kiss, because this is telling you what's better for you. And so just like the last slide was the opposite, butter was the worst. This slide is focused on the fact that, as Dr. Neighbor Stevens just said, you know where your choice is. Olive oil is the best. So
So I've heard of people drinking a tablespoon of olive oil every day. I don't know if that's medical, but I've heard of it happening. Have you, Dr. Neighbor Stevens?
Oh, I'm seeing it in the press all the time. What I'm not seeing is the studies that show that it's effective. But the folklore, olive oil cures everything from tinnitus to senility, from Alzheimer's and heart disease.
Next slide. And take this one if you would, Dr. Neighbor Stevens.
The effect on LDL cholesterol. And I have trouble keeping these fats straight. So I learned them. The LDL is the lousy one, and the HDL is the happy one. That's the only way I can keep it straight. So I'm happy to pass that little tip on to the audience. So the effect on LDL cholesterol. Well, you're probably not going to be shocked when I say butter knocks it out the Paul part. Because remember, butter had the highest percent of saturated fat. The spread's about midway, and olive oil is down. And if you follow the line, it leads you to olive oil. And again, it confirms the wise choice would be to use olive oil if you want to have any effect on lowering your LDL.
Why does butter taste so good?
There are a
Next,
lot of things that taste good that are not necessarily good for you.
next slide.
Just remember moderation.
moderation.
So, so what is plaque? You can think of it as like rust in a pipe. So a very small increase over time matters. So you may have a little bit of plaque when you're 30 and a whole lot of plaque when you get to be 50, but it's cumulative. It increases over time and time matters. Prevention is the key. Next line. So there's certain medications. Dr. Walsh, want to take these?
Sure. Medication classes or types of medication or groups of medication. We talked earlier about the statins, and they can reduce production of this bad cholesterol. As the reduces absorption of the bad cholesterol, and the PCSK9 inhibitor can increase the clearance. And then we have the omega-3s, which can lower your triglycerides. So we talked earlier about putting things together. It's great to know that these different medication classes work in different ways. So if you got to pile one on top of the other, Dr. Maxey's earlier comment about a triple threat, you can have a triple threat against that piling up of the cholesterol and the plaque in your arteries.
Yeah, wasn't Babe Ruth a triple threat? Wasn't he a pitcher originally?
He did pitch and he did hit.
Okay.
Um, there's some other people that get less press than Babe Ruth that did a great job. They
Like
look more like you and me.
Hank Aaron. Next slide. So this is Dr. Lawson with us yet?
I don't see him yet. I don't know.
Dr. Neighbor Stevens?
So I was just checking. I thought and making sure I remembered this correctly. Remember earlier we said the first line of approach to managing this is lifestyle changes. And so the lifestyle essentials are a healthy diet, regular exercise, weight management, and avoid smoking. That first one, healthy diet, made me verify what I thought. Because on the previous slide, we had said that omega-3 is one of the ways to approach your treatment. And we can find omega-3s in fatty fish like salmon, mackerel, and sardines, seeds like chia and flaxseed, walnuts, and fortified foods like eggs.
And
Well,
avoid smoking is very important too. That messes with your endothelium, the inside lining of your blood vessels, and makes plaque. That's nobody should smoke or be in the room with people who smoke. That's
Now,
something,
is that just tobacco or anything that's burning?
anything, anything. It can be pot, marijuana, Mary Jane, candle smoke. A lot of people have a lot of odoriferous candles that generate smoke. And secondhand smoke, I gave a lecture some years ago, and secondhand smoke is sometimes often more dangerous than firsthand smoke. And it gets in the walls, your paper, your drapes, and your floors, your rugs. So smoking in general is not good for cardiovascular health. Let's go to the next slide.
I'm not trying to be funny, but what about barbecue smoke?
Well, of course, that's non-toxic at all.
the
You
smoke, the smoke
can,
is bad for you. The barbecue is bad for you. Sometimes the relatives at the cookout can be bad for you.
there
So
you go. So take this, Dr. Neighbor, see so you can pronounce that word.
Oh, you want to test me today? Dimpedoic acid.
good.
This is a statin intolerance option. Now, why is this so important? A lot of people can't take statins. They suffer. I believe the main complaint is cramping, but there's some other side effects that are intolerable for them. And the good thing about this choice is that it's oral.
Next slide. So the other main thing that has changed in the guidelines is this goes now to the youth, and we start screening youth at 10 years of age. So not 40, not 50, but 10 years of age. And especially those that have familiar hypercholesterolemia in their families. So this is in your area, Dr. Neighbor Stevens, that these kids that you see need to be checked at least once early. Next slide.
Well, I was told in medical school, I'm a little annoyed that that factor is becoming such a uh, eye-opening fact now. Because when I was in medical school, they cited the study of World War II autopsies in very young men, where they found, and I don't remember the statistic, but an extraordinarily high level of plaque present in the young victims in World War II. So it's been known for a while that we have some issues with probably the biggest part of it is diet.
That's true. What goes around comes back around again.
Hmm.
So, new implementation guidance to treat early and treat the target and combine therapy, triple threat. Next slide. So, Dr. Wilson will give the take home messages.
Take home messages. Please take these home. Share them. Lower, especially we're talking about your low density lipoprotein, your LDL. Lower is better. You want to measure the ApoAB over LPA, and you want to use
It's a
what are we saying CAC means, Dr. Maxey?
calcium score. The calcium score in your arteries. That's what your heart doctor does as an imaging study, which would be contraindicated if you have CKD and kidney failure. But your doctor can actually determine how much plaque is in your blood vessels. That's what CS is. Next slide. Dr.
So,
Neighbor.
so Dr. Maxey, before you go away from that slide, Dr. Neighbor Stevens mentioned these autopsy results from young men in World War II. And I remember reading, now I'm not the cardiologist, but I remember reading that you can just go merrily along your way and have no symptoms and feel like nothing is wrong while your arteries are getting blocked and blocked and blocked and blocked, and you might be over 90% blocked before you know anything is wrong. Is that still true?
Is very true. Very true.
So that whole CAC thing is important.
And it's not just your heart block that we need to be aware of and concerned about as health consumers. I don't know if the members, those in the audience today recall, but maybe 2 years ago, 3 years ago, we had a very interesting session on peripheral artery disease and
Mm-hmm.
how prevalent it is, although people don't know it's so prevalent, and doctors are not necessarily approaching it in the most effective way. So anywhere the red cell goes through that arterial tube is subject to getting blocked.
That's true. And the name is cardiovascular. So cardio is first, but vascular means that those same blood vessels that get blocked run through your brain and all the other organs in your body. So we use the word cardiovascular, everybody thinks heart, but it's everything. And having a stroke can mess up the rest of your day, Dr. Walks.
Yeah. Yes, sir.
That's
Yes,
neighbor.
sir.
See, when I take this last slide.
Our key takeaways: know your numbers, control your LDL early, and do whatever you can to prevent heart disease. That is, don't just rely on medicine, but you want to change your lifestyle.
And I think this is the last slide. Is it, Simon? So earlier I spoke with one of our guests and I asked her if I had permission to call on her for a brief comment. Is she unmuted?
Okay, I'm unmuted now.
Can you give us very briefly what your story is and what your thoughts are?
I resisted taking statins for 10 years. Doctors kept telling me they wanted me to take statins. I didn't want to, so I didn't. And I went from no atherosclerosis to now I have it. And of the abdomen, the abdominal aorta. And so I quickly got onto atorvastatin. I started out, though, they first gave me the ezetimibe, and that worked at first. And you guys told me, I think it was Dr. Wall said, well, good luck with that. So it did work for a minute, and then it got crazy again. So now I'm on atorvastatin, but just 20 milligrams. And my cholesterol is much better now. The LDL has gone from, oh shucks, it just went away. It went from, actually, my total cholesterol was 211 and now it's down to 137.
Wow.
And the LDL was 127 and it's down to 45 now.
Oh my goodness.
Um, and I was telling you before that I noticed that in the last 2 months, my HDL had gone from it was all the way at 94 and it went down to 75 in the last 2 months. They're watching me pretty closely out here. And so it's probably because, like you said, I stopped exercise. I wasn't exercising for the probably last month. And I usually go to the gym once a day, at least 5 days a week, if not seven. And then I stopped and I went all the way down to maybe twice a week. So I'm gonna get that back up starting tomorrow.
Uh, Dr. Neighbor Stephen told me to tell you, God bless you. That's the beautiful numbers that you have. Those are really good numbers and a good example of what's going on. Thank you so much.
I'm excited and I thank you for telling me to do it and I didn't pay any attention, but I now I'm paying attention, so I'm doing better.
Thank you very much. Any other comments in the chat or questions?
I have a comment, Dr. Matthews. I
Yes,
think that I think that we focus, first of all, Linda Hall, yay, A plus. We are you are the star student. I think we do focus a lot on those numbers, and those numbers are important. But I'd like to ask a question. If you're going to the gym 5 days a week and you are um, exercising properly, um, isn't another benefit of that that you feel way better? Whatever the numbers are, don't you feel better when your body's in motion and you're exercising? She's on mute now, so she can't tell me no, that's not true. So I'm going to accept that as an affirmative response. I think that we talk a lot about the preventing illness part of our healthcare journey and advice. And I want to give feeling better a shout out. I want to give being able to stoop down and pick something up a shout out because it's important for us to recognize that if we do these things, we don't only have healthier arteries, but we feel better. And for those of us who are vain, we look a little better too. You know, everything fits a little better. And it's nice when you're walking down the street and you're not leaning forward, bending over, or as my wife likes to say, why are you making those noises when you walk? I'm like, hey, I'm doing the best I can. So thank you very much, Ms. Hall, for sharing with us. It's important.
thank you, Ms. Hall. I hope we have another guest who would speak for a moment about their experience or their thoughts. That would be very good. Who can we pick on, Dr. Neighbor Stevens?
I'm sorry, what did you say?
I said, who can we pick on to make a comment?
Um,
Is Dr. Gibson?
no. But I see Dr. Sherrod is on, and I know that Dr. Sherrod is a student of healthy lifestyle. So I was wondering if she would like to make a comment.
Dr. Sherrod. Is she unmuted?
Not
Not
quite
yet.
yet.
And is Dr. Dawes on?
No.
Did somebody mention something about avocado?
There was a comment earlier asking about avocado and coconut. Thoughts about avocado and coconut oil. This was when we were talking earlier about the benefits of olive oil over butter.
Well, one of
So
the issues with avocado oil is the temperature at which it tends to burn, as opposed, and you have to be careful with olive oil too. Oils like canola oil can get a lot higher without burning.
And what about peanut oil? That's I know what I fried used to fry turkeys and I used to do that.
Well, that's a pretty high temperature, so I don't use peanut oil, so I really can't comment on peanut oil. But
So
that going back to coconut oil, and I don't know where that discussion has landed, but a few years ago there was a lot of discussion about whether or not coconut oil was good to use or not because of its percent saturated fat. So it was kind of pushed there for a while, but I think there has been some retrenchment in the advocacy for the use of coconut oil.
okay. All right. Well, we've covered the subject, and I think that this has been a very relevant subject to what we're going through every day. And I thank you, Dr. Neighbor Stevens, for bringing that up. Last weekend, we looked for uh, certain cardiologists to come on, but we may have them repeat this, and it'll just drive it home better. So let's go for some of our closing comments as we close this out. Dr. Walks?
thank you, Dr. Maxey. I think that for me, a couple of quick things I want to say. One of them is that Dr. Neighbor Stevens talked earlier about um, stuff that we've known for a long time that we tend to not push, and that is that young people um, can have a real problem with high cholesterol, and everybody doesn't have David Letterman's money. Why am I saying that? Wasn't David Letterman the one that had preemptive quadruple bypass because his arteries were clogged, but he hadn't had a heart attack yet? I think it was him, if I remember correctly. This was years and years ago. To just say, hey, look, go in there and switch it all out because my arteries got all clogged up and I don't want to have a heart attack. So before my heart muscle gets damaged, let me do this. I think it was him. I'm not sure, but if it was him, I don't have his money. And so it's much less costly for me to do the prevention as opposed to trying to fix something that goes wrong later. And then the other thing I want to say is if you all haven't gone on Netflix and seen the old Save the Children concert that Jesse Jackson led with Operation Push back in 1972, they remastered it digitally and it's now on Netflix, the Save the Children concert. Why would I mention that on Black Health Trust? Because our friend, I wish he was on today, Brenda Lee Ager, is shown in 1972 singing with Jerry Butler. And it is amazing to have access to her and the work that she does with us on Black Health Trust here in 2026, and then see her in 1972 in a digitally remastered copy singing with Jerry Butler. I was over what y'all say over the moon. I was over the moon watching Brenda Lee Ager, our Black Health Trust friend, and she has she ain't just on for 2 seconds. She has a nice little piece in the Save the Children concert that you can find on Netflix.
Save is it on YouTube as well or just Netflix?
I'm not fancy like you, Dr. Maxey. I just pay my money and have Netflix. I don't know nothing about no YouTube, but it's on Netflix.
All right. Well, I'm going to look for it. I met her back in those years. I actually met her in 1968.
All
I was
right.
singing with Jerry Butler. We did a concert for the Howard University Mississippi project, and
Mm,
her Jerry Butler, Donnie Hathaway, and
mm.
and a group called the Ohio Players.
Yes.
Yeah.
Really, and the first black senator, a guy named Ed Brooke, was one of our main guests back
Nice.
in the day. Dr. Barbara Davis Stevens.
Well, I'd like to close us out with I hope you will think, pleasant thought that what we've been talking about doesn't have to be looked at as being arduous or a task that you don't want to take on. I would like for us to recenter our thinking. What we're talking is about is healthy living for the whole family. So we're not
Correct.
talking about something that just grandma needs to do, something that maybe daddy needs to do. No, we all need to do it, including, if not more importantly, the kids need to do. So we need to cook healthy. We need to make healthy choices when we eat out. We need to play together and get our activity in and enjoy some family time.
That's important. And based on what you're saying, you have more family time the healthier you are. And
You
I've been concerned today about every day waking up and knowing where you are. And even more than that, Dr. Wilkes, whose you are. That's a part of
And
the health, know whose you are. And I see a lot of comments. I can see I can see the chat today. I can never see the chat, but except today I do. And somebody said they remember listening to the Ohio players back in the day. So I'm blessed I can read these things in the chat. Thanks everybody. Have a great, great day. Thank you, Simon, very much for helping put all this together. Have a great day, Dr. Walks and Dr. Neighbor Stevens, and thanks for helping me with the slides. Have a great day.
bye.
amen. Good day, everyone.